most powerful human emotion, like passionate love and peace, are conveyed through red and white colors. These colors represent passion and purity. Passion and purity came together to create an ambience that set the perfect venue of a conference at Nairobi Safari Park Hotel, as it hosted delegates from Africa and overseas in expressing love and care for the health of people deprived with their liberty. Indeed, Kenya was best suited to host the first ever African conference on health in detention. Motivated by the Nelson Mandela quote that it always seems impossible until it's done, the theme of the conference was making the difference. In specific, African solutions to improving health in detention. The conference was organized by the ICRC, International Committee of Red Cross, and co-hosted by the Kenya State Department for Correctional Service, in partnership with Ministry of Health of Kenya, Kenya Red Cross Society, Africa Correctional Services Association, African Center for Disease Control and Prevention, and International Corrections and Prisons Association. To showcase the key achievement attained across African continent since the first World Conference on Health in Detention in the year 2022, the ICRC had invited senior representatives of correctional services departments from African countries with a will to promote and encourage respect for the right to health of people deprived of their liberty, to debate concerns and exchange ideas to put forward an integrated health system in detention in their countries.
We can have Dr. Chombi to take up these questions.
Ok, merci aux différents intervenants qui ont fait des commentaires et des questions. Alors, je vais essayer de donner quelques éléments de réponse à ma disposition. Comme je l'ai dit, c'est un travail de groupe. Nous avons ici.
Although the official language of the conference was English, some moderators opted to use the French language because the conference had provided necessary equipment to allow simultaneous interpretation of any language, hence hindering communication barrier. The delegates were also served with exquisite Kenyan dishes prepared by the hotel staff, topping it up with fruits in the quest to ensure a balanced diet. Remember, let food be thy medicine, and medicine be thy food.
أكثر تقدما في تطبيق مفاهيم حقوق الإنسان.
الفكر العقابي الحديث يعني استغلال فترة قضاء المصري المحكوم عليه عقوبته في إعادة تأهيله للعرض لأنه
The conference featured videos and posters exhibitions, plenary and symposium sessions, with delegates asking questions to make it an interactive session while learning from each other.
My question, I would like to ask it to Madam Kimati. What do you do to avoid some
some issues that we face in our countries to determine the real age of people. You know, we had some issues who made that we could incarcerate people in the prison, and finally find out that they were under the age of 18 when they were arrested. I don't know about Kenya, but in my country, people under the age of 18 are minor. And those more than who are aged, who are old more than 18 are adults. I don't know about Kenya. And we had some problems sometimes to determine exactly the real age of people, because they could allege that they were under the age of 18 or allege that they were adults. And then I would like to know your experience in that, if you have already experienced something like that, and what do you do exactly? What do you do to determine exactly the age of people? That was my question. Thank you.
Dealing with these adolescents, first you'll be guided by their birth certificates, if they have them. That will tell us how old they are. In case they do not have birth certificates, you depend upon the court to make orders for determination of age. So then they'll be taken to the hospitals. The doctors will ascertain their age, and the age that the doctors give us, that is their age. Irrespective of if we can see they are older or they are younger, but since we are not an authority in determining age, we will depend on that which the doctors have told us. Thank you.
The aim of the International Committee of Red Cross work in detention is to ensure that dignity and well-being of the inmates is respected, and that their conditions of detention are in line with the law and internationally recognized standards as articulated by their representatives.
You will know, Elena is the head of detention unit for the International Committee of the Red Cross. Her programme team have operated and had impact in more than 40 different countries. Elena directly has been responsible for contributing to the thought leadership around healthcare in detention through writing many of the reference manuals that we refer to. And she, great kudos, is a wonderful medical doctor, as well as having an MSc in humanitarian leadership, I believe. So
okay. You have a better memory than I.
It's a pleasure to be here with you.
Indeed, the conference was a funny, educative gathering, since when you thought that you were done with laughter, more laughter came your way, just to relax your mind.
Then I allow him to deliver the presentation. Then I will allow him to go and sit. Then I will introduce the next presenter. But one of the things I want to warn you from the beginning, I will need more questions. And the question should be directed to everybody. At the end of the session, if you give 3 questions to him, you must also give 3 questions to him. You must also make sure we are talking about fair and just here.
Thank you very much, Commissioner General. I think that's all the time that I have now, given the very long preamble, so maybe I'll just sit down. So, my name's Ivan Calder. I have the privilege of being the Chief Exec for Health Rewards. My organisation has worked with many of you in your justice systems, focusing on healthcare, and if anyone's interested to have a conversation with me about opportunities to attract funding into your systems or to make good change, to enliven the recommendations from the ICRC conference in Geneva, then please come and talk to me. We've got 3 days together, and I can't wait to become friends with those of you who I don't know and re-establish the relationships with those of you I do. but not many people in this room are part of the healthcare network. And I think it's a really important vehicle for exchanging knowledge and information and learning and inviting each other into a problem-solving space that can help us collectively fix many of the challenges that we face in our correctional systems.
My name is Harriet. I'm the Communications Officer, KPS.
How has the conference been, and what's your takeout from the first day in the conference?
Okay, this is a conference by ICRC for health in detention, for people in detention. So basically for the Kenya Prison Service is learning the good practices and seeing how we can improve the health of those in detention and how to control communicable and non-communicable diseases within the prisons.
Okay, and what are you looking forward to in the 2 coming days? Because I understand this was the first day, you have 2 more days to come. What are you looking forward to?
Learning good practices and sharing, identifying maybe the gaps that we have within, comparing ourselves to other detention and other prisons within the continent. So maybe identifying gaps and yes, maybe and learning the good practices from other people and also sharing our good practices because we have good practices.
My name is Dr. Augustina Bwedu from Ghana, Assistant Director of Prisons. So what I have to say is that indeed it's the first African conference on health in detention, and I am happy about what I've seen and heard so far. I am happy I have met a lot of people from the correctional services across Africa, and we are learning and sharing knowledge. I am particularly happy about the topics that have been discussed so far. I have learned a lot. I have learned from Mali. I have learned something from Kenya and other prisons, adolescent prison systems and how they are managing health in detention and a whole lot of them. It's interesting and it's eye-opening and I am learning. I believe others are also learning, and I know that at the end of the conference, the theme for the conference that is making the difference, African solutions to improving health in detention, will be achieved.
The conference is going well. It's my first time to sit in the conference of this nature, but anyway, I can see the way people are participating, contributing different views, different ideas, opinions from different parts of the world. Yeah, I'm really getting that the people are trying to achieve the same goals.
My name is Assistant Commissioner Martha Ilonga, heading healthcare services from Namibia, Correctional Service.
Thank you so much for your time. How has your first day been? What are your takeouts from the first day of the conference? And what does this conference mean to you?
Yeah, so this is the first day for the conference. Yeah, the day it's really well, it's really good. The conference is very much interesting. I'm learning a lot. I'm learning what other countries are doing, especially the best practices, so that we can also able to go and do the same to our country in order to improve the health of inmates that are incarcerated.
And maybe, are there any expectations you had when coming today, and have you learned 1 or 2 things?
Yeah, no, the expectation, I just want to, we are here to strive for one goal. So we just want to really to come up with one goal that is really going to change or improve the health of inmates that are incarcerated.
Maybe what are you looking forward to in the next coming 2 days? I understand you're here for the next additional 2 days. What are your expectations and what are you looking forward to?
Yeah, so for the next 2 days, I'm really hoping for the best, that at the end of the conference, we have a common call that we are going to achieve, and we are going to implement the recommendation that will be coming out from the conference, so that at the end of the day, this conference, it will become a reality whereby it's at the end of the day, it's really going to improve the healthcare in detention in Africa. So we want to change the living standards, the treatment of our inmates in Africa. Remember, they also human beings and they need to be respected like any other person. Thank you.
Thank you so much for your time, madam, and enjoy your evening.
Thank you.
Okay.